Hey loves, what's up? It's your girl back with another video. Hey, thanks for joining me. Today, once again, I'm being consistent. I'm so happy, I'm so proud of myself. Anyways, y'all just need to watch, okay? I'm consistent, so y'all just need to view my videos, rate, comment, subscribe, support, please. So that gives me motivation. That encourages me to be more consistent, y'all. Okay. So anyways, this video is just a real quick video. Like I said, I was going to be giving you guys more detail on like how to become a medical assistant, certain responsibilities, places that you can work after you become a medical assistant, pros and cons to being a medical assistant, and just different information on the career overall in itself. So again, after you've finished your program and you take your state test or however, I'm just going to list off a couple different places that you can work as a medical assistant, okay? So one place that you can work is a family doctor. So everybody knows your family doctor is where you go to get your preventative care. That's where you go if you have any concerns or issues or illnesses. You start off at your family doctor. And if you go there and you have a certain issue that they cannot manage or handle for you, then usually they will refer you out to a specialist, some type of specialist, depending on what your situation is or, you know, what the issue is. So that is just your regular family doctor. And usually family doctors will see, it's a wide variety of people. There's no age limit. They see from babies, newborns, all the way to geriatric and elderly patients. So with that being said, you can you can also work at a podiatrist office where they specialize in seeing children, minors, anybody 18 and under is usually a peds office, not podiatrist, I'm sorry, pediatric. A pediatric office where you're dealing with children only. So if you have a you know, if you really like kids and you have patience, because you do have to have patience, then you can definitely work with kids in a pediatrics office or a pediatrician's office. Usually with that, you're going to be doing a lot of well child exams where they just go to the doctors just to make sure that they're well. That's once a year, you know, just regular physical type stuff. You're going to be administering immunizations so that's what you're going to be doing with your peds patients. So, and then of course they go for their sick visits. Kids get sick, quite often. It's not. It's very common for children to get the common cold and things like that. So you again would take your child to their pediatrician. And same with just like a family doctor, if your child is having some type of issue or concern or something like that, and they cannot handle or manage or, treat whatever issue that child is there for, they will refer that child out to a specialist. So next I'm going to go through the list of specialists that you could work for, and any specialty practice is going to have a one for children too. So for example, cardiologists, you have a cardiologist for your regular adults, and then you have pediatric cardiology as well. So anyhow, since I said cardiologist, I'll go from there. So you can work for a cardiologist that's dealing with the heart. So if you would like to, you could work there. If you do, a lot of people have interest in certain areas of the body because maybe they're familiar with it or they've had issues or their family member has had issues dealing with that. Like say, for instance, a lot of people want to work with cardiac patients because maybe they have a long family history of cardiac issues and you want to be more knowledgeable in that area. So again, that might be your desire to work in that area for certain issues. So anyways, cardiology, dealing with the heart, you might be doing EKGs, which is a quick electrical taking a quick electrical picture of the heart. So basically you hook the patient up and it literally gives the doctor a basic knowledge of a basic understanding of what's going on with the patient. Like if the patient's having chest pain or something like that, it can let them know if the patient has had a mild heart attack or if something more serious is going on and the patient needs further evaluation of the heart. So because it is just a basic test of the heart. So basically you're going to be dealing with patients with hypertension, which is high blood pressure and things like that. Anything related to the heart system is going to be your cardiologist. You have the endocrine system. You can work with a endocrinologist that deals with like diabetes, any type of hormones, like thyroid issues, autoimmune diseases like lupus and things like that, or any other rare autoimmune diseases, is going to be an endocrinologist. So if you, for example, go to your family doctor and you go because you're diabetic, and maybe your family doctor tried to manage your diabetes and they can't keep you at a manageable or a therapeutic safe level, then they might refer you out to endocrinologists because that is their area. They specialize in the endocrine system with diabetes and different things like that. So they're more knowledgeable than the family doctor. Family doctors, like I said, are knowledgeable in that area as well. But when you have a chronically ill patient that you cannot manage well, then they will refer them out to a doctor that specializes in that particular area. So you could work for an outpatient, like a surgery center or any place that does minor surgeries, and then you would be helping the doctors, assisting them in those particular surgeries that they're doing. Again, they're minor surgeries, nothing major. So outpatient surgery is where the patient has a procedure done and after the procedure, they recover in the office for maybe an hour or so, and then they can go home. So that's going to consist of a minor surgery. Where your major surgeries, the patient is heavily sedated with anesthesia, and they have to remain in the hospital for an extended amount of time after they have a procedure. Usually we are not, those aren't usually our areas as a medical assistant when you're dealing with major surgeries. Usually we assist with minor surgeries. So like a colonoscopy or which is dealing with the colon, checking to make sure you don't have colon cancer. So basically it's a procedure that helps the doctors to identify if you have any existing issues that would warrant further, evaluation to make sure you don't have colon cancer and things like that. Also, let's see, dermatologist, which is dealing with the skin. So any type of skin disorders, skin diseases, whether they're rare or common, skin cancers, a lot of that is going to be dermatology. You're going to be doing a lot of assisting the doctor in removing and doing certain procedures pertaining to the skin as well when you work for dermatology. And of course you would be trained for all of that. So they do a lot of procedures with the skin. Again, usually they're using some type of anesthetic. It's usually like a local anesthetic to numb whatever area that they're working on. And then, they do the procedure and the patient is free to go home after the procedure. You're going to be doing, you could also work for, again, a podiatrist that deals with the feet. A lot of diabetics have to see a podiatrist once a year because that for neuropathy, which is like numbness in the feet, numbness and tingling. And that's a condition due to being diabetic for your patients that are not well managed. So bunions, just different things, anything dealing with the feet and the toes. There's a lot of different conditions and things like that patients can have that will warrant them to see a podiatrist. You can work for a pain doctor that deals with patients with chronic pain, whether it's from an accident or whether it's from another illness or disease that they have that would cause them to have chronic pain. And usually with that, the certain things that they deal with is like they might do a nerve block, they might do joint injections, they might do which is going to be, you know, injections in the shoulder or the knee, the hip, the wrist, things like that. You could work for a chiropractor. You could work for a neurologist that deals with anything that pertains to the nerve or any type of head injury or head trauma, things like that. You could work for an oncologist, which deals with any type of cancer patients. Pulmonologist that deals with the respiratory system and the lungs. So any type of asthma, COPD, any type of lung issue is where you're going to be, your pulmonology patients is going to be referred to. Ortho that deals with the bones, if you break a bone or something like that, anything pertaining to and dealing with the bones is going to be your orthopedic specialist. Geriatrician, so that's going to be all your elderly patients. So the elderly patients could see a family doctor as well, but a lot of elderly patients do require a lot they require more attention because, you know, as you get older, we develop more issues and more diseases and different things like that. So it requires more of your time. So a lot of people prefer to see a geriatrician that's going to specialize and they're able to offer those patients more time because a lot of your elderly patients end up in the hospital more frequently for longer periods of time. And a lot of geriatricians will go into the hospital when their patient ends up into the hospital for a particular reason. They'll go into the hospital and treat them in the hospital as well. Because if you're a family doctor, a lot of times they don't have time to go and do rounds and see their patients that are in the hospital. So that's where those types of doctors come in handy, and those are the reasons why your elderly patients would be going into and seeing a geriatrician instead of a regular family doctor. So those are just a few, some examples. You could work in a hospital, you know, and then your roles and responsibilities are going to be a little different. Either any of these offices you could work at as a medical assistant. And then not only that, you could be clinical, which is more hands-on with the patients, doing injections and doing different testing on the patient. Or you could work as a medical assistant in the front staff where you're checking patients in, doing insurances, you're doing referrals where you're referring patients to different doctors and different things like that. So it just depends like what your, you know, where your passion is. You know, for me, I prefer to work hands-on with the patients. I love the clinical aspect of being a medical assistant. You know, obviously I'm trained as administrative as well, and I don't mind working administrative. I've been utilized in both areas of the office. But my passion is clinical, and that is where I mainly work at. Like I said, I've been cross-trained. It's good to be cross-trained because you're more valuable. You're a better candidate if you have experience in the administrative aspect, which is like more of the office day-to-day stuff, and also being cross-trained, being more hands-on with the patients, doing the injections, the blood draws, the tests on the different patients and things like that. So, like I said, this is gonna probably wrap the video up for this particular session. And like I said, I just wanted to give you guys an idea of like what options are out there as far as being a medical assistant. You could work also weight loss clinics. That's another place that you could work at. It's just the opportunities are really, you know, endless. So, anyhow, like I said, I'm going to wrap it up. The next session is probably, I'm going to talk a little more about the different roles and responsibilities and the different testing and things like that we're allowed to do for our patients as a medical assistant. And kind of go from there. Like I said, I'm going to come to you guys with a lot of different content on this subject and in this area. For those of you that are inquiring or wondering about being a medical assistant or wanting to choose this as a field, a career in this field, just to give you guys some knowledge and, you know, a little bit of information before you go off and decide to do this, because it's not for everybody. You know, you do have to be a passionate, caring person, because you're dealing with people that are ill, that are sick, and just not feeling well. So you do have to have that compassion and be sympathetic and empathetic to people in this field. You know, if you're not a people person, then this might not be the field for you. So just keep that in mind. You know, you don't want to spend the time or the money going to school and find out that this is not what you want to do. So I'm sure there's a lot of other videos out here as well too, just giving you information on what it is to be a medical assistant and to what to expect before you just jump into you know, putting all your time and energy into something that, you know, is not going to be a passion for you. So just keep that in mind. I'll be back with some other videos, you guys. So keep watching, comment, rate, subscribe, and deuces.